Welcome back to another episode of HealthCap Weekly Wrap.
This week, we're covering a range of stories that matter to senior living professionals, from important updates in dialysis system regulations and vaccine schedules, to exciting innovations like virtual reality fall risk assessments. We'll also take a look at how states are pushing forward legislation that could reshape resident care and how the World Health Organization is getting serious about governing AI in healthcare.
And finally, we'll wrap up with something a little more personal: how what we wear might actually influence how we feel. Let's dive in.
So, kicking things off this week, CMS just released a new memo, QSO 2517 ESRD, and it's all about pre-configured hemodialysis systems.
Yeah, this is a pretty technical update, but really important. These systems are increasingly being used both in-center and for home dialysis. And the memo clarifies how providers should be using them in compliance with CMS requirements.
Right. So these pre-configured systems come with preset components, including things like the water purification setup and the dialysate concentrate. CMS is saying if you're using one of these systems, you have to follow the FDA-approved labeling exactly as intended.
And that's not just about setup. It's also about ongoing monitoring. The memo emphasizes that providers still need to verify water and dialysate quality to make sure the equipment is working properly. So even if the system is plug and play, the responsibility doesn't stop once it's installed.
Exactly. It's a reminder that convenience doesn't override compliance. And for senior living communities that offer or coordinate dialysis care, this really matters. It impacts training, safety protocols, and your partnership with providers.
And honestly, for teams working in senior care, understanding how these systems work and what CMS expects could be a key factor in making sure residents are receiving dialysis treatments that meet the highest standards.
Next up, we're talking about vaccines, specifically the latest updates from the Advisory Committee on Immunization Practices, or ACIP.
Yeah, so after a 2-month delay, ACIP finally met and voted on several key vaccine changes for 2025. They addressed recommendations for meningococcal disease, RSV, and chikungunya.
Right, but one big thing to note, they didn't vote on influenza. That's a little unusual considering how central flu vaccinations are, especially in senior living communities.
But they did signal that more updates are coming in June, including discussions around COVID-19, HPV, and Mpox vaccines. So we're expecting more clarity soon.
So what does this mean for senior living teams? Well, it's a reminder that immunization planning needs to stay flexible. We're dealing with shifting guidance, and communities will need to be ready to adapt schedules, consent processes, and communication with families.
Exactly. And RSV in particular is one to watch. The newer vaccines for older adults could be a real game changer, but only if they're incorporated smoothly into resident care.
It's all about staying ahead. When vaccine guidance changes, how quickly your community can respond makes a difference in resident well-being.
All right, now this next story is pretty exciting. It's about a Temple University professor who's using virtual reality to help assess fall risk in older adults. Professor Jeffrey Wright co-founded a startup called Upright VR. This was reported in a March 2025 article from Temple University News, where they shared how the technology uses immersive virtual environments to test balance and mobility in ways that go beyond traditional screening. And the cool part? It's not just about reacting to a checklist. The system places users in realistic scenarios, like walking down a busy street or navigating uneven terrain. So clinicians can see how someone might actually respond in daily life.
That's huge for fall prevention. Because as we all know, falls are one of the leading causes of injury in senior living communities. And being able to identify risk earlier and more accurately, that could change how we approach care planning entirely.
Exactly. Plus, this kind of technology can be engaging for residents. It's more interactive, and that might even improve compliance or interest during assessments.
And for communities that want to stay on the cutting edge of resident safety, VR could be a meaningful tool to add to your toolbox, especially as the tech becomes more accessible and user-friendly.
Now, shifting gears a bit, let's talk about artificial intelligence and healthcare governance.
Yeah, the World Health Organization just announced a new collaborating center on AI for health governance, and it's based at the Delft University of Technology in the Netherlands. This was published by the WHO on March 6, 2025, and you can find the full article at who.int.
And what makes this interesting is that the center isn't focused on building AI tools. It's about making sure those tools are developed and used responsibly. Their goal is to help countries build ethical frameworks and policies that make AI more trustworthy in healthcare settings.
That's especially important in senior living, where AI is becoming more common, like we just talked about with predictive tools for fall risk. You're also seeing it in voice assistants, scheduling automations, and even resident engagement platforms. These tools can be incredibly helpful, but only if they're designed and deployed in ways that are fair, transparent, and accountable.
Exactly. The WHO emphasized principles like human rights, equity, and public trust in this announcement. That means making sure AI systems don't reinforce bias and that communities have a say in how these tools are used.
And for leadership teams in senior living communities, this is a good reminder. If you're considering any AI-powered solutions, whether clinical or administrative, it's worth asking who designed them, how they make decisions, and how your team will stay in the loop.
This new center is a step toward global guidance, but it also signals that ethical AI isn't optional. It's the foundation of resident-centered innovation.
All right, next up, let's look at how different states are tackling senior living issues through proposed legislation.
Yeah, this one comes from McKnight's Senior Living, and it highlights how state lawmakers across the country are addressing a wide range of concerns that impact senior communities.
In California, for example, there's a proposal to expand dementia education for law enforcement and emergency responders, something that could make a big difference during crisis calls involving residents.
Meanwhile, in Colorado, lawmakers are looking into the issue of wheelchair repair monopolies. Delays in equipment repairs can seriously affect a resident's mobility and independence, so this kind of legislation could have real day-to-day impact.
And in Utah, there's a proposal focused on camera use in resident rooms. That raises important questions around privacy, dignity, and how to balance transparency with resident autonomy.
Right, and what ties all of this together is that these are quality-of-life issues. They're not just regulatory, they touch on how residents live, how they're supported, and how communities advocate for their needs.
For leadership teams, this is a reminder to stay tuned in to state-level activity. These proposals could lead to changes in training, policies, or even infrastructure. And being proactive can help you stay ahead of what's coming.
All right, let's close things out with a story that's a little more personal. This one comes from CNN Health, and it's all about the connection between what we wear and how we feel.
Yeah, the article explores something called enclothed cognition, which is basically the idea that our clothing doesn't just change how people see us, it actually affects how we see ourselves and how we behave.
Exactly. So, for example, wearing professional attire might help someone feel more confident or capable, while comfortable clothes could help reduce stress and improve focus. It's not just about fashion. It's about how clothing can support mental and emotional well-being.
And in the context of senior living, this really hits home. Whether it's residents choosing what to wear each day or how staff present themselves in uniform, those choices can influence mood, dignity, and engagement.
Yeah, and it goes both ways. Helping residents express themselves through clothing can be empowering. And for staff, feeling comfortable and professional can support confidence and a positive mindset on the floor.
So it's a good reminder. Something as simple as what we put on in the morning can shape how we move through the day. And in our communities, those small choices can add up to a big impact on culture and care.
And that concludes this week's episode of HealthCap Weekly Wrap.
We hope you found something valuable in these stories, whether it's a new idea to bring back to your team, a fresh perspective on policy, or just a reminder of how every detail can shape the resident experience.
For more information and links to the full articles, head over to the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
Thanks for listening, and we'll see you next week.